This is something that has to be a global project. It's as global as climate change, I'll put it that way. Because cancer is the reward we got for curing the infectious diseases that kept our lifespan so low through the 20th century. And now we're going to have a cancer growth around the world, which requires us to research it around the world.
The cost of actually treating cancer around the world is enormous. The most important point for us is to put in place a global infrastructure which allows more people to be treated successfully than they have been in the past. At the end of the day, this is about saving lives, and if we can get to that route in the most cost-effective way, even better.
The cancer treatment and care needs to really reach out not just to the lowest income people, but also to the remotest people. What that would entail is to work with a lot of the local hospitals and the primary care centers so that the first level of treatment can actually be delivered much closer to where the patients are.
Patient value across Asia is critically important. I mean, we spoke earlier about affordability, we spoke about access to basic facilities, the lack of infrastructure, the lack of nurses that support patients. So it's a much, much bigger problem. And the patients are at the heart and core of this issue. Their voice is key and critical to ensuring that people listen, because there's nothing more powerful than a patient journey to be heard.
I see that patients don't know their rights, not just among peers or family or friends, but in terms of how they engage the broader system. I think patients need to be empowered, they need to be trained, because that's not something that you would typically sort of pick up along the way, especially even if you are a patient or even if you are a survivor.
Well, today we heard a very emotional story about the patient journey through breast cancer. And as I reflect back on that particular session, the reality is you need to aggregate those emotional stories together so that it becomes a qualitative and quantitative data to enable decision makers. Especially in the Philippines, for instance, we talk about how we can build that capability in order to aggregate data so that we can use that powerful information in order to enable decision by policymakers.
1 in every 2 cancer patients in the world actually lives in Asia. What we've also seen is that patients are living increasingly longer with and after their cancer diagnosis. And those patients looking at not just what their treatment outcomes should be clinically, but actually what are the outcomes in terms of quality of life and patient experience. So we think it's essential that we actually capture those experiences and we understand what's important to patients so we can design services that do meet the needs of patients not just now but in the future.